incredibly excited to be doing this with Startup Health, launching the 13th moonshot around T1D, type 1 diabetes. At the end of the day, diabetes doesn't go away. People with type 1 diabetes and their families cope with it 24/7, whether they're in the mood for it or not. And there's a huge cost to our system when someone has a low blood sugar and they need medical support, or they need admission to the ER, or they have high blood sugars that result in the complications associated with diabetes like cardiovascular or neuropathy, loss of feeling in the arms and legs, and blindness. There's huge cost to the system. So this is a big problem for roughly 2 million Americans and countless others around the world. And we need to further innovate, and we need to scale the work to prevent, manage, and cure diabetes. Now, the current state of the industry is you have pockets of nonprofits or industry, pharma, medical device companies all going at it more in silos. And the opportunity with the T1D Moonshot with Startup Health is to leverage Startup Health's background in breaking down silos and bringing everybody together as one team. One day we'll have a cure, and we need to work for it. But we also need a commercial ecosystem to support that research for a cure, and we also need to do the work to prevent and manage in the meantime, and we need to do it together. There are groups that are focusing on early stage research. There are groups that are focused on advanced science and molecular design. There are groups that are looking at how do you manage diabetes today and apply, smart insulins and intelligent devices to manage diabetes. And then there's a whole group that are focused on the prevention and science around that. And then you also have the global impact. We're not talking about the US, but what happens if innovation is happening in Brazil? How do we bring that innovation to scale in Brazil and then bring it out to the rest of the world? India and China have some of the largest percentages of diabetes in the world. How do we affect those parts and other parts of the world as well? So the concept of the moonshot is, let's bring everybody together. Let's bring the best innovation, collaboration, debate it out, invest in entrepreneurship, in leadership that have a transformative mindset, that are willing to go the distance to prevent, manage, and cure. And let's also make sure that everything we're doing is for the whole U.S. population. That's why we brought Sarah Altman's on, Chief Strategy Officer for Robinhood, to make sure that we're focused on the underserved part of the population. That, again, this is for the all access in the U.S. And then let's make sure we go global. And a lot of the thought leaders we have on the Impact Board have a lot of global experience as well, so that we could impact not only the U.S. but the world. Right now, if you're a scientist and you have a great, concept to advance the cure for T1D or help manage it, you have to pitch multiple grants to get funding and to cover your expenses to take this innovation to the next level. Well, imagine being part of the Startup Health community and getting funding and peer networking and guidance on entrepreneurship and connections with folks in industry, that you can commercially scale your innovation and be guided to the things that are going to have the most impact. So that's one concrete way of breaking down the silos and reducing the dependence on, annual grants. Another part is, when I look at my own experience in founding Cecelia, I had to pitch hundreds of investors that may or may not have known what even diabetes was, to find the ones that invested in our Series A and B and onward. And imagine if the community is connected with investors who are already passionate about investing in T1D, and that's all made simple through the Startup Health Moonshot. The Impact Board was selected, and we really attracted the people who have a personal passion for transforming the T1D landscape, but they also want to collaborate. And so David Panzera, who's trustee of the Helmsley Charitable Trust, who has been an evangelist for the T1D industry, and Helmsley has invested hundreds of millions of dollars in innovation, again, through grants, will continue to do it. And now they can partner with Startup Health to help commercialize and scale the level of impact and entities. Robert Oringer, who's an entrepreneur in an industry, Mike Mason from Lilly, and a bunch of others, which we could get into, all have tremendous domain expertise to really help T1D at startuphealth.com. So T1D for type 1 diabetes at startuphealth.com. Whether you're an entrepreneur, whether you're an investor, that's the one email to remember that will get the right people to respond to you and bring you in to the communication and share the content that's relevant. So if you're an investor who wants to allocate your capital around the social impact, and you're passionate about solving the diabetes, maybe you have a family member with type 1 or a friend, or you've seen the impact, in the community, let us know, and we'll make sure to involve you there. If you're an entrepreneur, take a look at the materials we just published in a great Startup Health article. We included a scorecard, which is essentially a blueprint that the Impact Board came up with for what are the things that we need to do and to transform the diabetes landscape. And look at what you're building, how it aligns with that scorecard. And if you feel the synergy, mention that in the email, and we'll have that conversation, because we want a call for innovation. We want all these great entrepreneurs and thought leaders who want to do something positive to come into the Startup Health community and collaborate. We're looking at solutions that solve for the whole person. For example, just the mechanics of diabetes is good, but it's more traditional. But transformative thinking looks at, okay, 40% of the people with type 1 diabetes have some form of stress and mental anxiety. So do you have something there? Do you have something around cardiovascular disease or obesity? Because believe it or not, over 95% of the people with type 1 diabetes have a comorbidity. So you're looking at the whole person. Do you have access to care? Is your solution available to everyone, even in a particular geography where you don't have to have it now, but will you plan and commit to expand and make it available? Those are some of the things that are in the scorecard, and certainly we could drill down on that. But the inside also, we want entrepreneurs who have the right mindset, that they're committed to really make a difference in the long term, and they're willing to plug away day in and day out to make this happen, and they're willing to collaborate with their peers and contribute and learn, together.